Hello, this is Teresa Williams, Manager of Healthcare Informatics for Via Christi. I was asked to put together a short video to help providers navigate through all of the data that is being collected on the patients that they see. There's really one answer that we have currently, and that is OneChart. All of the information that you are putting into OneChart then becomes the information that gets collected by these agencies. What I want to show you is the easiest way to get some of that information in there and just let you know about a few updates. Some updates that have happened recently in OneChart is the CSSRS ad hoc tool has been added to comprehensive intake. This is what clinical staff fills out when they're rooming your patient. So if you have a patient that needs that assessment done, the clinical staff can do it very easily from their comprehensive intake. A change that was made on 3 education codes, the BMI education code as well as the smoking cessation education codes, is that these codes no longer charge the patient. So nothing gets sent to the patient as far as billing when you put in these codes. That was not the case in the past, and we heard a lot of dissatisfaction from both providers and patients that they were being billed for this education and their insurance wasn't paying for it. So now any of these 3 codes that you put in will not bill the patient. The benefit of these codes is so that it's very easy for somebody who's reviewing your chart to be able to see that you did this education. You still want to put a note about the education documentation in your note, something in your assessment and plan that just says patient provided with diet and exercise education, for instance, would meet the measure on BMI education. We do, just speaking about BMI, we do need to always be sure that height and weight are both documented on each patient, each visit. We see some areas where that doesn't always happen. If you're seeing that, we know that's something the clinical staff is doing. If you're seeing that, please be sure to let your manager know so that they can speak to staff about that, because that will affect then some of your rankings. A couple of things that are on the way that are in the works with OneChart. One is the addition of the PHQ-9 to comprehensive intake. This will make it easier for staff who's doing the PHQ-2 and it gets a positive score to go quickly to the PHQ-9 and do that before the provider even comes into the room. Obviously, if the PHQ-9 is positive, the provider would want to address that. We're adding the addition of Cologuard as a satisfier for colorectal screenings on health maintenance. It's going to be added as DNA testing, so as other companies come along doing this testing, we won't just be that brand name. A third thing that's happening soon is diabetic eye exams. Sometimes your patients will bring in or send in the paper eye exam that they've had done elsewhere. If those are sent for scanning, that will soon be a satisfier for health maintenance. So it will show on your diabetic patients that an eye exam has been done. Speaking of health maintenance, and you'll also hear us refer to it as patient advisories because that's another name for it. Soon it will be called recommendations. We're getting ready to add recommendations to the ambulatory workflow page, so you'll be able to see it there as well. Just a little reminder, when you're talking about patient advisories, health maintenance, this is the screen we're talking about. This is kind of the hub of keeping track of all of that information for your patient. We're talking specifically about adult patients. We really don't have things set up for pediatric patients just yet. We do have flu shot, I think, shows so that we could meet that measure for some of our pediatric providers, but this is primarily for adult patients. You find it one of 2 ways right now. One is from your patient summary page, health maintenance, and you just click on health maintenance, or from your table of contents where it's called patient advisories. Takes you to the exact same place. Cerner just isn't using one name, they're using a couple of different names and soon to be 3 names, because soon it's going to be added to your ambulatory workflow page. For those of you who use Dynamic Doc, you'll be able to address those issues here. But from patient summary or ambulatory summary, we go to health maintenance. A couple of things we just wanted to remind you of. One is if you uncheck this show satisfiers, then you get more real estate on your page. You can see more things more easily. Here on this patient, and this is a test patient, so they're due for everything. We have to do a lot more scrolling. You also can set the amount of time that you're seeing, and this would be globally, so any patient you see. Right now I'm just seeing 6 months. If I go to health maintenance, preferences, I can set that really anywhere I want. If I want to see what the patient is going to be due in the next year, if I'm reviewing this maybe just at your annual exams, then I can change that and set that as well. Also can set to see how far back something was satisfied in the past. Really totally just up to you. It does affect the loading the more that you have in there. So if you're looking for 10 years worth of information, then it may take slightly longer for this page to load. A couple of things that we hear from providers sometimes is that health maintenance gives expectations that they don't really, pending expectations that they don't really think apply to that patient. Remember, the age and sex of the patient indicates what is in here. Also, chronic problems. So if the patient has been diagnosed with asthma, with COPD, with diabetes, it will add things to this, to health maintenance, and which is a good thing. But if there's something on there that does not belong to that patient, and sometimes we'll see, well, this is a good example of varicella. So this is a 37-year-old patient, and you say that patient had chickenpox when they were a child. Why is it showing varicella? Well, the system doesn't have any way to know. If we've not documented that they had chickenpox, the system doesn't have any way to know. But there's a one-time, all you have to do, and it can be the provider, it can be clinical staff, is click on cancel permanently. Give a reason. We'll say that they already had the disease. You can put a comment note, but you don't have to, and okay, and it's going to take that off of the screen for that patient. So it's one time. So as we go through our patients, and we're not suggesting that every time a patient comes in we go to health maintenance, but maybe we do on our yearly exams. Maybe we do, we certainly do when the patient is being seen by a nurse navigator or someone, but we just need to move towards that. So it's going to take that off the screen. It won't take it off till I refresh, and since this patient has so many, we'll just continue to move on. But it's just a good place to keep track of that information. I also, if my patient, for this patient, it's showing that they need a lipid screen every 5 years. If I want to change that, if my patient needs to have them every year, I can click on the Q5 years, and again, this can be anybody. The clinical staff can do this as well, and I can change the frequency. So I can make them specific. Now this change is only going to be for this one patient, which is how we would want it. When I make the change to my preferences, I'm doing that for every patient and what I'm going to see. So there's really a lot of power in health maintenance, and there's reports that we can run based on this information, and this is where a lot of the information is coming from when they're doing reports to send out to other people who are keeping track of what we're doing. So it's important that we begin to embrace health maintenance. We use it. If we find problems with it, because occasionally we do, as people use it, please let us know. Please tell us what you're thinking, because we want to try to make it better. A couple of additional reminders that we want to give you, and just kind of as a reminder, sorry about that. One is on breast cancer screening, mammograms, and colonoscopies. When those are done outside of Via Christi, if you get the report from other provider, if you send it to scanning, they will put it in the chart, and it will meet those expectations for health maintenance. If you write on there what the recommendations are, or circle what the other provider has given you, then they will also put those into the system. So for instance, if instead of needing another colonoscopy in 10 years, this patient needs it in 5 years, if you write that on the report or circle it on the report, then that information will get put in by HIM. Now what they can't do is if there's a range, like if it said 5 to 7 years, we need to designate, is it 5 years, is it 7 years, is it 6 years, and put that in. Also, if we're pulling those things, when we get paper records on new patients from other providers, if we will pull out the mammograms, pull out the colonoscopies, and send those separately to HIM, then those will also get abstracted. HIM has started recently with electronic things that they get, like on discs, CDs. They will pull that information out, but on paper, it's just too labor intensive. We recently made some corrections on the pneumonia vaccine, made the correction so that it is accounting for the 2 immunizations instead of just the 1. Those also should be abstracted when they're being done somewhere else. If somebody's going to Walgreens or Dillon's and having that information, having that immunization done, we want to be sure that we get that abstracted, and that can be done by anybody in the office. One last thing, most of the programs that we're working with want a repeat blood pressure. If the patient's first blood pressure in the office was over something like 140 over 90, there's a More Vitals tab on comprehensive intake, which is generally what the clinical staff use, but they can certainly add that in. You can put it in your note, and the chances are very good that somebody's going to find that repeat, but if you put it in the More Vitals repeat blood pressure or have someone else put that in, then it's just going to be easier to find, and we're going to be more likely to meet the measures that we're trying to meet. It's all about putting the information in the right spot so that it's easily found by anybody who's looking for it. Please ask us questions. You have a liaison in your area who has some special knowledge about OneChart. It can get information. You also have an informaticist that is in your office. Regularly ask them, call them, email them. Reach out to me. My name's Teresa Williams. I'm the manager of the Healthcare Informatics Department team. Please reach out to me. If there are things that we can make better, we want to try to do that. We are in a system, a model system, and we work with Ascension and Cerner, so we can't always make all the changes that we want to make, and we can't always make them today, but that's our job, and we're trying to make things better. We make small improvements. Small improvements add up to big improvements. So thank you for listening, and please let us know if you have questions. Thank you.